stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
To another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. Our phone number is 954-717-7027. I am your host, Louise Gomez. Welcome to the show. And today we have Dr. Cristal Grant-Spence, who is a mobile podiatrist, and her phone number is 954-663-0986. And the website is cgsmedconsult.com. Welcome to the show, Dr. Spence. Thank you for joining us today. Oh, I can't hear you. Hold on. Oh, there you go. Welcome to the show, Dr. Spence. Thank you for joining us.
Thank you so much for having me.
Absolutely. And so, Dr. Spence, this is the first time I have ever met a mobile podiatrist. So this is going to be exciting to delve into, how did this whole come about, this whole, mobile podiatry. But if you can share with us a little bit about your background and where did you go to school and where did you study?
Absolutely. So I actually was born and raised in Long Island, New York. And I did go to medical school at the New York College of Podiatric Medicine. I did my residency in New York also. And my residency was in surgery and wound care. So I was able to kind of see a wide gamut of some of the things that can affect the lower leg and feet. And it was great experience to prepare me to be out here in the world. And about 2008, after I completed residency, I moved to South Florida.
Nice.
And South Florida is a really interesting mix because it was very different from New York. The patient population is very different, and also kind of the patient needs are very different.
I'm from New York as well originally, so I know you went to a good school, and I know the differences as far as certain things coming from New York are different. But from a doctor's perspective, what were the patients? How were the patients' needs different from what your experience was?
Well, the thing about New York is because it's such a busy and fast-moving place, people are kind of always on their own and they stay pretty independent pretty long. But one of the things I noticed when I first got to Florida was that, mobility and transportation and things like that played a major part in people's healthcare, and also in their ability to consistently see the doctor and have proper care. And so for me, when I first opened my office in 2010, I received calls pretty quickly asking if I did house calls. And before then, it really had never crossed my mind, but there was such a demand and a need that I, started doing house calls at that point, and it just continued to grow.
I love it. So out of the necessity, as they say, invention is necessity is the mother of invention, right? So your patients were asking for that, and you stepped up to the plate. Was that a hard decision to do? Because you went from not only doing house calls, but now you have a mobile unit, right? Where you, how do you treat them? Were you able to bring all of your equipment and stuff?
So initially I had done a little bit of work during residency where we went out to nursing homes and ALFs. So I figured at first that maybe it was going to be similar to that. But reality was that the patients I would meet in the field needed all of the services that I provided in the office. So that meant that I had to kind of, like you said, necessity is the mother of invention. I had to kind of figure out a way to bring the entire office with me. So I would go out to patients that had wounds and they needed wound vacs placed, or patients that needed injections or that needed debridements. And so I ended up figuring out how to make it all mobile and take it all with me.
Wow. That's a large feat. That's a large task to, endeavor.
No pun intended.
Exactly. I mean, to be able to do that, do you bring anyone with you, or do you go alone, or how does that work?
I do. So when I got that first call in the office asking if I did house calls, I just said, yeah, sure. I was pretty new in my office. And within about a month, I had 65 house call patients that were sent over. And immediately I went to my
Wow.
husband and said, baby, please, can you help me out? And so he started to help me 2 days a week. And ultimately, within about 2 years, we ended up closing the physical office and we went completely mobile.
Wow, that's amazing. And you know what? I feel like people are wanting to go back to that old school way where the doctor would come and do the visits and the house calls. How do you find that how do you find the patients? Are they obviously they're calling you. You had 65 in such a short period of time, but are they preferring that for you to come to them?
Absolutely. I mean, I think that the thing that's happened in healthcare with, the introduction of managed care and some of the, HMO plans is that people have become accustomed to having very long wait times in offices and, not having as much time and attention that they might like with their doctors, or not even, necessarily seeing the doctor, maybe seeing a physician extender. And so this did take things back kind of to a generation before where, somebody shows up with the bag and the instruments and they're just there to see you, and they're making sure that whatever your needs and your questions are, they're being answered. And from a health and convenience standpoint, obviously, for some people, sitting in an office for 2 hours is just not feasible or not comfortable. I've had a lot of patients who, they're diabetics. They can't sit outside for 3 or 4 hours. Their blood sugar won't maintain, they're not stable. So it allowed for me to be able to see people who many times weren't seeing any other doctors because they weren't able to get transportation or they weren't able to comply because of their other health issues. Right. Sometimes I was the only set of eyes that was, on them.
That's amazing. So I know that, and the patient really benefits, but you as a doctor, how has it changed for you to now go and to see them in their location and where they're at? How has that shifted for you?
Well, for me, honestly, one of the biggest motivating factors towards me deciding to go completely mobile was I had the experience of treating patients in the office and only having 5 or 10 minutes to spend with them and not feeling like I had done them the service that I really wanted to do. And that's, of course, because even though we're physicians, we're running a business, there's fiscal considerations. But going mobile allowed me to be able to go in and see patients and treat them the way that I was comfortable, where I felt like they were going to be getting the full complement of care that was, that I was comfortable with. It allowed me a better quality of practice, and feeling more secure that I left them in a good place.
It's a win-win. I feel like
Absolutely.
it's a win-win for everyone because you get to interact with them on their turf and where they're at, so they feel more comfortable, and you get to maybe see some, other things that are helpful to you, how they live, or if they need special assessment, you're treating their foot, right? So if you go into their home and you see that something's dangerous, I would imagine you're able to really get a bigger picture as to really helping them a lot better.
Absolutely. I mean, I think that the unique thing about it, I ended up, when I did decide to really just focus on the mobile end of my practice, I ended up reaching out to home health agencies because, of course, they're going to have the largest population of people who are homebound, who have some of those compromised circumstances. And like you said, many times going out into the home as a physician, I was seeing things that I could raise to the attention of the primary care, or,
Right.
referring for therapy, like fall prevention, and making sure that they were in safe circumstances, they were getting the therapies that they needed. Because as I said, if they're not going out to their doctors, then, who's
Mm.
making sure that they're safe? Who's making sure that they're getting all the care that they need? So home health agencies became my major partner. In fact, All County sent me quite a few patients.
Oh,
So,
that's wonderful. I'm so happy to hear that we're able to do that. That's amazing. So what is the age range of the patients that you're treating?
so really the age range is much broader than people might think. I work with patients from children. We would go out to homes where they had that were like for developmentally disabled, or where children were living in, essentially a group home or a care home setting.
Oh,
So
okay.
from very young children all the way to, my oldest patient is 110. So I would say we cover the
Amazing.
whole gamut. Yeah.
Oh my goodness. That is amazing. 110. So, doctor, could you tell us what major insurances do you take? What would those be?
So I work directly and accept Medicare assignment. So that's traditional Medicare. Outside of that, I do have the option for people to utilize a very affordable self-care scale. I mean, a self-pay scale,
Mhm.
where if you do have an HMO or another insurance that we don't participate with, you are able to go through our website. You can book appointments, you can make payments via credit card, or and we have other, apps and things that we work with. And I found most times that allows for, that the daughter of the patient that's down here, and they're maybe getting most of their care through a clinic, but they're not satisfied with the care they're getting on their feet. And, I have a lot of people from California and New York, and they're sending me out to see their parents and making sure that they're okay. And they're just going straight to the website and taking care of that for them.
Wow, that is amazing. I'm going to give that website again. cgsmobilefootcare.com. And your phone number again, 954-663-0986. Yeah, that makes sense. I mean, a lot of people come to retire in Florida, so you probably get phone calls from the kids that are in other places in New York and California, check in on my parents. So that's really good that you're able to cater to those people as well.
Yeah, and it gives them an extra sense of comfort because they know someone's going again into the home. So
Yes.
they know that they don't have to worry about them getting there. They
Mhm.
know that if something is going on, if they just had a fall, if they, someone's going to see it and make them aware.
Mhm.
So again, it's just another layer of protection. And I find that also, being that we do accept Medicare assignment, it does make it pretty simple for my patients with traditional Medicare. They don't have to worry about receiving a bill, or,
Right.
that there's going to be services that they're getting that aren't covered. And we always make sure that whatever agency that we're working with, if we do identify additional services that they need, that we send them into that same agency so they're getting continuity of care.
Oh, okay. I like that. Well, Dr. Spence, what is the most common I would ask, what is the most common thing that you see? Is it a sprained ankle? Is it people falling? Or what is common for you that you see?
So obviously the most common thing that most podiatrists are going to see are going to be fungal nails or ingrown toenails. It's your routine care. So you're
Okay.
dealing with, people that have challenges cutting their nails, whether it be because the nails themselves are diseased or
Mm,
because they no longer have the mobility to be able to bend over and cut them. Maybe they have arthritis in the hands or vision loss that impacts their ability to be able to take care of some of those hygiene tasks. So
mm.
that's going to be the most common thing. Now, in some of the younger population, a lot of ingrown toenails, a lot of the athletes who, have trouble from
Yeah.
their activities. And that's going to be the most common things are going to be the routine care things. Other than that, a lot of heel pain and,
Okay.
like you said, sprain strains.
We got a quick commercial break. We'll be right back. We'll continue the conversation.
Great.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in to You and Your Doctor. I have the pleasure of speaking with today Dr. Cristal Grant-Spence. And again, her phone number is 954-663-0986. She is a mobile podiatrist, and her website is cgsmedconsult.com. Thanks for coming back and chatting with us, Dr. Spence.
Absolutely.
Yeah, and so we were talking about, like, what are some common things that you find? Now, I know you mentioned something about, like, diabetes. Can you explain to us, because I've heard, I'm not familiar, but I've heard that people who have diabetes maybe have some special needs with their feet, or how does that, what should people look out for their aging
Absolutely.
parents, right?
Absolutely. So one of the most common complications of diabetes is going to be neuropathy, which is essentially where the nerves are no longer working the way that they should. And you may be getting reduced sensation or hypersensation. So either you're feeling a lot less or you're feeling too much. Either way, it puts patients at risk for developing cuts, bruises, scrapes, ulcers, and ultimately infections because they're not aware that something is going on. And many times at that point, things have kind of gone further than they should. So as a result, most diabetics in the office are going to be sent for a podiatry evaluation.
Oh,
but
good.
if you are not able to go into the doctor's office, what's happening to those diabetics that are homebound or that, you know, are not able to easily access? So that's exactly where we come in. Every patient we see that is a diabetic, we do perform a foot evaluation where we check to see how their nerves are functioning. Obviously, it becomes much more safe to have a podiatrist doing their routine foot care and taking care of any concerns. And also just keeping eyes on it in case anything does develop. And I can't tell you how many times I've gone in and found a new wound that a patient didn't even know was there.
Wow.
And sometimes there are patients that have nurses in their homes every day, but they're not, you know, looking in between their toes or underneath the back of their heel or, you know, some of the areas that I might be seeing. So diabetic foot care is one of the big areas that, you know, there really is a need. And one of the other things is patients that have vascular issues, circulatory issues, poor circulation. So whether it be swelling or retaining of fluid, or where they have very poor circulation, where they're not getting enough blood into their feet, very easy and very common to develop injuries to the skin or infections to the skin. And so that's, again, something that we're looking out for and, you know, making sure that their feet are being taken care of and they're staying safe.
Yeah, I mean, there's so many different challenges. I remember, I just had a flash. I remember when I was pregnant, my feet used to get swollen. I would lay on the floor and elevate my legs against the wall, and it really was a relief for me. So I imagine, Yeah, I mean, I can't imagine people who have to deal with the swelling like that, more frequently, other than the temporary, being pregnant, But
And that's the thing. I mean, sometimes people will have either lymphedema or fluid retention, and it can be young people, like you said, someone that's pregnant,
yeah,
someone who's had a recent trauma. And as a result, they now get an ingrown nail where they never had one because there's just so much fluid and the
true.
tissues become inflamed. It's pressing into the skin where it normally wouldn't. So simple things can become sometimes more complex things.
Absolutely. And it's, a fresh set of eyes. Like you said, there could be a nurse at the taking care of the patient, but a fresh set of eyes and a specialist like you who's going to look at and evaluate with a whole different, viewpoint. So that's really important to have that, I believe, for sure. Doctor, can you tell us of maybe, I don't know, maybe a feel-good story of a patient that you had that had a really good, successful recovery? And does anybody come to mind where you really helped them? We'd like to hear that.
Absolutely. There was a patient that I had once been sent from the hospital. This patient had been recently admitted, and he was a younger gentleman. He was in his mid-50s, but he did have a very severe case of diabetes and a lot of issues with his lower extremities. So when I first started to see him, he had a wound on the leg that he had for over a year that hadn't healed. And ultimately, what I started to do was the application of a specific wound care cast. It's called an Unaboot. That normally you
Unagood?
would only an
Okay.
Unaboot.
Okay. Okay.
Normally, you would only get that type of a treatment in a wound care center. But for
Okay.
him, he had vision issues. He had issues with transportation, so that's why the wound had stayed that way for so long. Ultimately, we were able to get his wound closed in about 2 months. Um,
Nice.
and after that, he was kind of one of our biggest cheerleaders. He went back to his agency and sung our praises. And he even actually gone back to, at one point for another hospitalization, he had seen a podiatrist.
Oh,
And that
okay.
doctor saw him again and asked him, how did his wounds get healed? And after he revealed that I had come to the house and how I had been treating it,
Nice.
that actually became a major referral source for us.
I love
And
that.
ultimately, they sent a lot of patients from their office that needed care that they no longer could service because they were homebound. And they became a major referral source for us.
Oh my God, I love that story. We actually have 30 seconds left. This interview went so fast. If we can just wrap it up, if you have any takeaways or anything you want to share in the last 30 seconds for our audience.
Absolutely. So first of all, thank you so much for having me.
Course.
It was a pleasure. Just so that your audience is aware, we do provide mobile services all throughout Palm Beach, Broward, and Miami-Dade counties. We do travel to their homes and facilities, so there's no need for them to make any adjustment. They literally just have to stay at home. We make the appointment, we confirm eligibility and insurance. They will never receive a bill from us because we make sure in advance they're fully aware of any cost or anything associated with their care.
Wonderful.
And
Thank you so much.
thank you so much for having me.
Yeah, we have to wrap it up. It's already time is up, but thank you for taking your time out of your schedule. We appreciate you. Take care, Dr. Smith.
Absolutely.
Okay.
Take care.
Bye.
Bye.